have a lot of patients who came to me. They told me that they've been coughing up blood. Yeah. So basically, the description of coughing up blood, they can have many different types. Yeah. Some patients, they can cough up blood very badly. It means that they can cough up a lot of blood clots. Yeah. When they cough up, a lot of fresh bloods can also come up. Yeah. Sometimes can be up to half cup, 1 cup, 2 cups, and sometimes even a pile of blood can be coughed up during the coughing up of blood event. Yeah. Some people can just have very minimal blood streak in their phlegm when they cough. This is also termed as coughing up blood, or medically we call it hemoptysis. Some patients describe pinkish colored phlegm when they cough. Yeah. So that is also considered as coughing up blood. Yeah. So those are the many types of coughing up blood. So when you explain to the doctor, please describe properly. Yeah. So the doctor can understand well and can identify the exact cause of your problem when you have coughing up blood in your phlegm. It depends. If let's say you are coughing up blood up to few cups of blood in your phlegm, definitely that is serious. But if it's additional coughing up blood with minimal blood streak, maybe that is not that serious. But if it happens for prolonged duration of time, those issues also need to be addressed. You have to investigate why you are having streak of blood in your phlegm. But if let's say you have a massive kind of blood in your phlegm, definitely you need to quickly call the ambulance. You need to quickly go to the emergency department in your hospital so that the coughing up blood, especially the massive one, can be addressed immediately. The blood streak, blood in your phlegm, the pinkish colored phlegm, also needing urgent medical attention. That's why you need to assess and you need to discuss with your doctor on what to do next when you develop this kind of coughing up issue. When you keep on coughing up blood non-stop, you will lose a lot of blood from your body. This will lead to a condition that we call anemia, which is low hemoglobin. So subsequently, patients who develop low hemoglobin or anemia, they can have symptoms. For example, they can have shortness of breath. They can have palpitation, means that their heart is beating very fast. They can also have giddiness. They can easily faint. And they can sometimes have loss of consciousness. This is the complication. Or what will happen if, let's say, you keep on coughing up blood continuously? It can lead to anemia. Another problem that can happen is that you might develop asphyxia, means that you can choke of your own blood. The blood that you cough can actually go back to the lungs, causing difficulty breathing, and this can lead to low oxygen level. And this can lead to death if we don't treat it properly. So that is why coughing up blood is an emergency situation, especially if you are coughing up a lot of blood, talking about 0.5 liter or at least 1 to 2 cups a day. We have many causes of lung diseases that can lead to coughing up blood. So when you talk about serious lung diseases, for example, tuberculosis, lung infection, lung cancer, pneumonia, bronchiectasis, those are the common causes of coughing up blood that can happen among our patients. Sometimes when someone is having prolonged cough, can be due to reflux or due to controlled asthma. This prolonged cough can also cause coughing up blood as well, especially if the forceful cough has actually injured the throat. And this injury is causing the streak in the phlegm. You need to also rule out other causes, such as acute pulmonary edema can also cause blood in the phlegm. So please make sure to discuss with your doctor, have a proper check so that the doctor can properly identify the cause of the blood in your phlegm, or when you have a problem of coughing up blood. Few tests that we need to do to identify the cause. Number one, you need to do a chest X-ray. It's an imaging, so that we can identify whether is there any significant lung involvement or is there any significant heart enlargement. And definitely blood tests. We need to check for any features of severe lung infection or viral infection or TB infection or cancer features. Subsequently, we need to also check the coagulation profile, means that the blood clotting ability. Sometimes people with a blood clot disorder can also have blood in their phlegm. Another thing that you need to do is you need to do a CT scan as well and identify the source of the bleed from the lung vessels that can lead to presence of blood in your phlegm. And subsequently, you might need to do a bronchoscopy, in which we put in a small camera into your nose, throat, into the lungs. From there, we can look into your inner part of the lung, see where is the exact source of the bleed, and we can stop bleeding area. So those are the tests that we can do to identify and treat the cause of your blood in your phlegm. So if let's say the cause of coughing up blood issue is TB or tuberculosis lung infection, definitely you need to treat the patient on anti-TB treatment. But if let's say the cause of the blood in phlegm is lung cancer, then you need to remove the cancer if it's an early stage, or if it's in late stage lung cancer, then the patient might benefit from chemotherapy or radiotherapy. If let's say the cause of blood in the phlegm is actually due to lung infection, definitely you need to treat the patient with antibiotics. You can also give medication, for example, tranexamic acid, to stop the coughing up blood to persist. Another thing that you might want to consider is that there is an option of what we call bronchial artery embolization. Means that we can put in a glue to the bleeding vessels that is actually causing the blood in the phlegm. But this one will need specialties like interventional radiologists, and patient have to do a proper CT angio first before deciding on that. What should you do if, let's say, you have problem coughing up blood, at the same time you started to feel giddy, you started to have difficulty breathing? Definitely you need to go to the hospital as soon as possible. Go there immediately. If you do not have any transportation, you can call in ambulance. This is definitely an emergency case. And try not to eat anything, because when someone is coughing up blood, we need to do an urgent CT scan to identify the cause of the bleeding. So in order to do the scan, you need to be fasted at least 2 to 4 hours before we can do the scan, so that the scan image can be more accurate. Subsequently, you might need to do a bronchoscopy, in which we put in a small camera into the nose, to the throat, to the lungs. And from there, we can wash the bleed, and we can also identify the area of bleed, and then we can try to stop the bleeding. Bronchoscopy procedure also requires someone to be fasted at least 4 to 6 hours before the procedure.